It's basically you're going to the same one, but
And then I'll be monitoring answering any questions concerning the
I'll erase the board, and if you have any problems, I'll be right here. You're live.
Okay. Hi everyone, welcome back. I think this is my second time, so I'm still a newbie.
Did you want a chair?
No, actually I'm good.
Yeah, let me just pull this out of your way here.
So welcome back to the Facebook Live event. I'm Dr. Shah.
YouTube and Twitter also.
And we're also on YouTube and Twitter. How about that? I'm Dr. Shah, board certified pulmonologist. And some of you have just gotten done with Alex. Very, very charismatic Alex. So that was a great class. So I just want to go over, why you should be in pulmonary rehab and who really should be in pulmonary rehab. In my opinion, everyone should be in pulmonary rehab. But
those are common questions that we brought in.
So, here's a question: how to manage a flare-up? So typically, flare-ups, most people, if you've had a flare-up, you know that your doctor will put you on antibiotics and or steroids. Maybe increase your inhalers a little bit more. The thing I want to let you know is that the sooner that you can talk to your doctor, get the advice from your doctor, the better. The other is knowing yourself, knowing that, yes, this is probably going to be a full-fledged exacerbation. We typically may categorize it mild, moderate, or severe. Moderate to severe being needing to go to the ER or the hospital. The mild to moderate kind of being treated at home with oral steroids and antibiotics. So that's very important. Is to know that it's coming on, know the seasons, know the times, know yourself. Know that it's going to get worse. You can't always know these things, but over a period of time, you might get kind of clues to your body as to if that's going to happen, and either have a plan already, meaning you have some antibiotics at home, you have some steroids at home that you start taking, and then call the doctor and say, hey, this is how I've been feeling. Is it okay to continue or should it stop? Or if you don't have those things at home, then call the doctor right away. I'm starting to feel that way. What should I do? And then have the doctor or the care practitioner kind of advise you. So that's something that a lot of people don't do. They kind of wait till the end, and then it's like you're already in that exacerbation period. And things can get worse from there. Exacerbations, by the way, do decrease lung function exponentially. So that's one of the biggest ways to decrease your lung function is by having these exacerbations. So by preventing them, you are actually keeping your lung function stable. Do oral steroids affect eye pressure? Yes, they do, actually. If you are not able to tolerate it, then talk to your doctor. Again, any of this advice, please speak to your doctor first. But yes, it can. Is food grade hydrogen peroxide safe to nebulize? Oh boy, that's kind of a loaded question. So the answer is yes, you can, and people do, and you can find a lot of videos on it on YouTube. I don't know from my practice, I've never prescribed it. None of my attendings have prescribed it. We've never used it in the hospital. We've never used it in my fellowship. We've never used it in medical school. We've never used it anywhere. So the answer is, that's up to you.
Now, when we did trach care, remember the trach cleaning kits? They used to have peroxide.
No, that's different.
And they took those out.
Yeah.
you know, they took those out because peroxide was getting in people's lungs and was
Yeah.
causing infections. So I always stayed away from it.
Again,
But that's
in my opinion, I'm with Alex. I don't really recommend it. Again, you can find those videos on YouTube. You can find them on other social platforms, but it's not, as far as I know, sanctioned, and so I cannot, give my blessing, so to speak. That would be up to you. What to do, and it's months to see pulmonary doctor. So that's a great question. One of the things, as I mentioned before, is to have kind of a care plan. And what I mean by that is, my exacerbations happen only in fall and the spring, or my exacerbations happen 3 times a year, or I start feeling lousy at certain times. You know, when the kids go to school, the grandkids go to school, then I start feeling that. So, one is knowing yourself. Are you someone that has recurrent exacerbations? What is the frequency? When do they happen? Is it weather related? Is it not? Is it grandkids or something else or not? You know, knowing the environment, knowing who you are, knowing that the frequency is very helpful. Then having kind of a plan as far as I mentioned before, having some antibiotics and some steroids. Some physicians will allow that, some will not. So it's up to your physician as well. So that's something you want to talk to them about. But having some kind of a plan if things get worse, I think is something, at least a start. Otherwise, it's very difficult sometimes to get in with a physician. If they have a nurse practitioner or a PA, maybe a little bit easier to get in with them. You can try that as well. Wake up with a bad headache. There was a question. Why do I wake up with bad headaches? Well, headaches can be many, many reasons. Now, if it's related to oxygen or not having enough oxygen, what you can do is 2 things. One is there's overnight pulse oximeters that your physician can provide or prescribe, and they go through the nighttime oxygen. Now, people don't realize what's happening at night with their oxygen. As you get into deeper stages of sleep, your oxygen level, let's say I have normal lungs, my oxygen level is going to go and fluctuate. All right, so let's say I lay down, I'm awake, my oxygen level is 98. I fall asleep, I'm in stage 2, my oxygen level may be from 98 to about 95. Now I'm in deep sleep, stage 3 to 4, my oxygen level with normal lungs may be 92. Now, if I have sleep apnea, it's going to go even lower. But add diseased lungs on top of that, you're going to fall off a cliff. Your oxygen level is going to go down into the low 80s, go into the 70s. And you're like, well, I'm on 2 liters of oxygen. Well, maybe you need 5 liters when you're sleeping, So that overnight pulse oximeter is very important. It records overnight, tells you if you need more oxygen or you don't. That may be one reason why you're having headaches. Positioning in bed may be another reason why you're having headaches. Maybe there's other things. There's many reasons, but make sure your oxygen level is good. Now, the other thing is, you may have good oxygen level, but are you ventilating? And that means if you're having a hard time ventilating during the day, you're going to have a hard time ventilating when you're lying down and sleeping at night. So a BiPAP or a CPAP may be something else that's more appropriate than just oxygen alone. Remember, if you're not breathing, whether you're in a room with full of oxygen, it's not going anywhere. So if you have sleep apnea and you're stopping breathing, or you have other issues with your breathing and you're not breathing, you can have all the oxygen in the world, but it's not getting in your body. So that may be another reason why you have headaches. But it's a very vague and general question, so I could really spend a whole hour just on that. What was that? 5 doctors to 3,000 patients. Not enough doctors. Why? That's a good question. Why aren't there enough doctors? I don't know. I think the population is growing, and as especially the baby boomers get older, we're having more issues and not enough doctors to. Having said that, they have increased some residency positions. They've increased the number of medical schools to try to accommodate some of this. So that they are looking at that. I quit smoking 5 months ago, but my breathing is worse than ever. Can't even walk to the restroom. Okay. So I also get this a lot that I was fine when I was smoking, and then all of a sudden I stopped smoking, and now things are worse.
I can help answer that too.
Yeah, go ahead.
Do I do? Look at that. Oh my goodness. No, but this happens quite a bit. Think about what happens in your lungs. Let's say you stop smoking. You're going to have a lot of repairing that's going to be taking place. A lot of, some fibrosis, some fibrotic tissues and things like that. So your lungs are going to get a little bit more dense as your body's trying to heal, in a sense, okay? So the reason why it's harder to breathe after you stop smoking is because now you have all this repairing happening, and now your lungs are going to become a little bit stiffer. As your lungs become stiff, it's going to make it hard to breathe. So what we do is we do hyperinflation therapy, bronchial hygiene. We'll do respiratory muscle training to get the lungs that are stiff to kind of stretch them out and get them to be more compliant. But you want to always do that in therapy. You don't want to do that independently like that. You want to at least be shown how to do that first.
Great.
So,
there's also a psychological effect when you stop smoking, because that nicotine is kind of stimulating you, and when you take it out, then you're looking for other avenues to kind of have that behavior of putting things to your mouth. So some people gain weight afterwards, and that's all part of the psychological effect of lack of the nicotine. The mythical 90 O2 level when medical personnel seem to panic. You seem to function very well at 89 to 90. Is that a general level that not? Okay, so the question is, this person is fine at lower oxygen level, whereas other people around them may be panicking. So if you're living at some people are living on the first floor of the building and they're very happy doing it, and other people like to live up top and see everything around them. It's just relatively where you're living, what your lungs are doing. The point though is you need oxygen for every part of your body. So we want a certain cutoff where we say this is really where the body is good. You may feel fine. The problem is people that feel fine at like 88, 89, they have very little reserve also. And, they can kind of tank very quickly. Make sure you have adequate amount of oxygen. Make sure when you're moving around that you have enough oxygen that it doesn't, precipitously drop. Make sure when you're sleeping you have adequate amount of oxygen. Always have adequate amount of oxygen. That doesn't mean that you want to turn it up all the way. Just talk to your doctor, but make sure you have adequate amount of oxygen. Can I improve enough to get off oxygen during the day? So you could get off oxygen. That all depends on several factors. One is, first of all, some people are on oxygen and they may or may not need it. Others are deconditioned, and once they get conditioned, they may not need it. and some people are just not breathing right, meaning they're very shallow, taking short breaths. They're not really using their diaphragm or intercostal muscles. So lung function, we cannot really affect that too much, the lungs themselves, but the structures around the lungs, the muscles, we can really, really help. So there is definitely possibility for getting off oxygen or at least stabilizing oxygen, maybe even decreasing it. Maybe you just need it when you're moving around or when you're sleeping, but you don't need it when you're sitting. So um, the different aspects. Can aspergillosis cause shortness of breath? Absolutely. So there are, Mary, um, there's aspergillus exposure, there's aspergillosis, there's invasive aspergillosis, then there's um, bronchopulmonary aspergillosis. So there's many different kinds. Now, typically aspergillus is the most common fungus that you'll see in your house. It's what they call the black mold. That's one of the black molds. And if you have molds like water, so if you have some water leak, you may see this black mold. If you're going into the bathroom quite frequently, like that specific bathroom, you're getting exposed to it. Over time, you can develop almost like an asthma. If you're immunocompromised, it could be a very, very nasty disease that needs antifungal therapy. But Mary, you're right, ABPA, that's what I was talking about. So ABPA, allergic bronchopulmonary aspergillosis, basically is like a bad asthma. And the way to treat it, typically, or initially anyway, it is to give steroids. That decreases the inflammation, that allows your immune system to kind of fight off the virus, the fungus, I'm sorry. But there are antifungals that we'll use as well to kind of subdue it and control it. Inhalers on top of that. But it usually presents as a very significant asthma.
There's another question. Are doctors aware of what is called burn pits in Iraq or Afghanistan? If so, how do you proceed with their lung care?
Well, burn pits we don't have around here.
Yeah.
But there's, so globally, asthma and COPD, besides smoking, people are using kind of maybe dung to make fires, and they're using them at home, like inside the house, where there's not good ventilation or there's a lot of pollution outside, and that can really affect the lungs. But we don't really have those issues too much here, unless you're in West Virginia or some parts of Pennsylvania where they used to do the coal mining and stuff.
Okay. Another one. How does congestive heart failure AFib affect emphysema stage 2?
So there's, I guess, two questions there, AFib and then heart failure. Heart failure will definitely affect it, whether it's right side or left side. Heart failure, it's just added shortness of breath. Another organ system that's kind of affected, so it's kind of a double whammy. Atrial fibrillation can give you shortness of breath because your rhythm is totally out of whack. If it's not well controlled as far as heart rate, there's a higher demand on the heart that will put more emphasis on breathing and make you more short of breath in that respect. Does coughing up green or yellow mean infection? Sheila, I would say yes. Let's say you have typically a cough with clear or white mucus that usually will indicate that that it's not infected. Green or yellow. Yellow is often, for most people, green. When it gets to that point, we're also sometimes thinking, especially if it's chronic disease, Pseudomonas. If it's recurrent, definitely has to be cultured. And then based on those cultures, you would want to be treated. Now, going back a little bit, some people will have darker colored mucus in the morning. It's because that mucus has been sitting there, and because of oxidation, it's going to get yellower. And then when they cough it out in the morning, it's yellow, or kind of a rusty color with some specks. That may be normal. As you go through the day, if it's clearing up and you are feeling the same and not feeling any worse, that's probably just mucus that's been sitting there, and it's just going to clear out. But green typically is more indicating infection. There's another question.
Yes.
Oh no, it's up. It's up.
Oh, sorry. I'm on steroids. I do that after juice. My throat is not red, but it's sort of white like an infection. I used last night.
Okay. Okay. So some people. So the question is, they are having issues with their inhaler and sore throat. The throat may look totally normal, and you still have loss of voice, or you have an irritated throat. I see that all the time in the office. The thing to do is either you switch the inhaler, or you switch the dose. So you may need a lower dose, or you may need a different inhaler, or you may knock out the steroid part of it. That's what I would recommend, because a lot of you're rinsing but may not be gargling deep enough. Either way, try a different inhaler or decrease the dose of the steroid that's in the current inhaler. It may also happen with other inhalers that don't have steroids in them. They can also affect your voice and give you sore throat. So again, trying a different inhaler, or maybe nebulized rather than inhaled. Try different things and see what works best for you. Is melon tea helpful? Is melon tea helpful? I would have to probably say that it's not going to hurt, but I'm not the expert on melon tea, so I would not gather to give my opinion on that. Opinion on regenerative stem cell medical treatment options. So there are companies that are doing stem cells. Stem cells are not currently approved. So that's all I can say about that. Those companies are for profit. Right now, they are working on stem cells, but it's not been as an approved therapy, to the best of my knowledge. I have seen Gummies advertised on Shark Tank, says will help quit smoking and help with breathing. They say pulmonologists recommend you for these. So I may have missed that episode of Shark Tank, so I don't know about the gummies, but if they have nicotine, they can help. Nicotine replacement can help. I think it's about like 15% effective, just nicotine alone. There's a medication called Zyban. When added, it's close to about 30%. Then behavior modifications would add a little bit more to that. But I'm not sure about the specific gummies that you're talking about. I get cramps in my chest and my breast, and is normal with COPD. So that can be normal with COPD, yes. You can get cramping.
They probably didn't understand the question. So somebody asked, I get cramps in my chest under my breast. Is this normal with COPD?
Well, cramps in general can be normal with COPD. So part of that may be make sure that your electrolytes are optimized. Make sure that if you're having any kind of sharp pains, is it pleurisy? If it's dull pains, make sure there's no fluid around your lungs. And if it's muscular pain, then it could be either musculoskeletal or arthritic type pain, or if you're hyperinflated, sometimes you can get kind of pains. So there's many reasons to have these kind of pains. Again, talk to your doctor, which is probably the cause of your pain. Sometimes you may not be able to find it. Like I said, could be muscular, could be skeletal or musculoskeletal, could be pleuritic, could be the lungs are hyperinflated or trapping air, so there's many reasons. I'm on Dalaresp. Any thoughts regarding side effects? So Dalaresp, one of the side effects typically is like weight loss. Dalaresp best for chronic bronchitis, not as good for emphysema. So slightly better for chronic bronchitis. It's not cheap either. Does it work? It works in specific patients. I would give it a trial, 6 months to a year, and then if it's not really doing much, probably would get off of it. I'm on OFEB. Does it help to get the lungs better? OFEB does not help get the lungs better. What it does is it tries to stabilize the lung function, and that's what. And actually spoke with a patient yesterday. She's not too bad with her pulmonary fibrosis, but I told her the sooner you get on it, the better, because you really want to prevent your lungs from getting worse. And if you're on OFEB, typically you have what's called idiopathic pulmonary fibrosis, which is a progressive disease, and it goes in steps, and they're downward steps. So the faster you get on the OFEB, or there's another one called Esbriet, which is now, I believe, generic in the form of pirfenidone. Unfortunately, the side effects are, GI side effects, diarrhea, bloating, so those kind of things. But they can adjust the dose to help with that. I have fluoroquinolone 1 associated disability from zipper damage. I have chronic fatigue. What can I do to help with this? I muscle cramp and spasm.
Can I answer something really quick?
Yeah.
Hey guys, I see there's a lot of questions about how to get my lungs better. We have not seen any medications that can get somebody better than our pulmonary rehab.
Absolutely.
So you want to get in pulmonary rehab instead of constantly trying to search. You have somebody who searches and searches and searches for something, and they completely neglect themselves because they're trying to find this answer like they're a puzzle in a sense. The longer you wait to get into the program, the worse it will be. So there is, to this date, there has been no medication that had people breathe better, exercise longer, had a much better prognosis than rehab. So pulmonary rehab, you want to get into pulmonary rehab as quickly as you can, not just using medications and medications and medications. I understand that they're necessary, but you got to get into rehab as quickly, and our rehab is not trying to put down any other rehab out there. We just know what we can do. And if we have a 98%
Absolutely.
with a 2.6 hospital readmission rate, there is no other pulmonary rehab that can get those numbers. We are the top elite ones. So please, 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 if you're looking for an answer on how to breathe better and get longer, walk further, get stronger, and get your life back, there is no medications that can do as good as a job as pulmonary rehab. So I just want to point that out.
This is great, Terry. I've been wanting to get into pulmonary rehab, but Doc doesn't order it. Then I would say you can come into our program, and we will work with your doctor to try to get the referral. I would definitely say there are some times where you have to take matters into your own hands. If your doctor is not referring you to pulmonary rehab, that is one of those times where you should take matters into your own hands and just go for it yourself, because coming out soon on chest, which is the one of the major kind of governing bodies of pulmonary medicine, the effects, the benefits of pulmonary rehab. It'll be published coming up pretty soon, but the results were so good that they started putting out articles about it already. So you know, it just blows my mind where, you know, it's like, you know, a lot of people when they come to us, they're kind of, you know, not understanding or don't know what to expect, or but then, you know, when they start and then they're like, wow, you guys like really changed my life. I mean, it's like that pot of gold at the, you know, end of the rainbow here. You know, it's like you found something, and it's like patient after patient after patient, and it's like review after review after review, and then still like, you know, it just blows my mind why you know, the doctors aren't referring when they know that it really helps, and it's safe and it's effective, and the benefits and the benefits are, you know, confidence, a generalized, you know, kind of well-being, just more owning what's going on in your life. It's just like amazing. So I mean, we have people that go to the hospital, and before they would be like, oh, you know, wouldn't have any idea, you know, what to do. Now we have patients after the program, and they're telling the therapist, "Oh, this is what I need to do right now. Oh, I got to get to do this right now." Like, you know, can you imagine going to the hospital and you're the one directing traffic? Like, it's just like you can't even like imagine something like that, you know. And you know, and I'm not saying they're trying to be arrogant or they're trying to, you know, direct care where it's against them. I'm saying that they know what to do, and they're so confident. It's just like, it just blows my mind. So please, pulmonary rehab, I would say for everyone, will tell you if you're right or not. For the most part, most people are good for a program, and you'll get a lot out of it. I mean, you know, you can forget your inhaler at home, but you'll never forget the pulmonary rehab techniques you learned, right? You know, you can lose your inhaler, but you can't lose how to personally breathe, right? You can't lose that. Somebody can't take that from you. So pulmonary rehab, you're gonna it's gonna be a part of you. It's gonna be a part of your life, and it's life changing. And an inhaler will help you, yes, but I've never heard, wow, this inhaler changed my life, you know?
Yeah, just Carol White and Patricia. Now remember, no, you're looking like, okay, like Carol White said, I've been doing rehab for 2 months, hasn't helped a bit. Our program is not the program you're at. Okay, what I'm trying to say is that you know, not all pulmonary rehabs have a high success rate like ours. Ours has a 98%. So the pulmonary rehab, no, if you go to any pulmonary rehab, they're not going to have those scores. They're not, you know, like the American Lung Association stated that every pulmonary rehab that's available besides us, every pulmonary rehab that's available right now has 11% success rate. So, Carol, of course, it's not going to help you a bit if you went to a bad pulmonary rehab. This pulmonary rehab, HRN, is the elite or the Bentley of them. It's the Cadillac of all rehabs. We're the ones that started the virtual program in the world. HRN was the first company out there, especially with the success rates of 98%. So you went to a bad pulmonary rehab, but that's okay. You still have a pulmonary rehab like ours, that has a much, much higher success rate, much, much higher. There isn't one program out there that can beat us. And that's a fact. You know, that is a fact, but you gotta do research when you're trying to find out which one is the better one. We're not just telling you it's the best one. Just look at the research that's out there. Look at the study papers out there. We're labeled and studied by other organizations to look at us, and they see us, okay, well, they do have a 2.4 hospital readmission rate, which is the lowest in history, with a 98 percentile success rate. These are things we can't make up. So if you went to another pulmonary rehab, trust me, it is not identical to ours. Ours is very, 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 very good, but only way you can find out is if you try it.
Now, the other thing is, You can refer yourself, and we will work with your doctor. You can get your doctor to refer you. You can get the hospital doctor to refer you. Your nurse practitioner or your PA can all refer you to pulmonary rehab. I just feel like my pulmonologist is just guessing at this point. I asked for pulmonary rehab, but he won't give it. I need a second opinion every time I go see him. He only listens to my breathing and says he will see me in 3 months. As a pulmonologist, I'm not here to bash any pulmonologist, but if that is certainly the case, I would say yes, you should get a second opinion. Pulmonary rehab should not be really denied to anyone. It's covered by most insurances. We take most insurances, and we will let you know as far as insurances are concerned. Just call us. We will work it out as far as insurances, as far as getting the referral. That's on us. But we want to help people. I would say this is the best thing I did for myself. I had long COVID and was told to get rehab. I found this group by searching online. They got back to me immediately, and I was on rehab about 7 weeks before a local rehab got back to me. Well, worth the time. Yeah, just try it. So great comment. So that's the other thing, and again, I'm not here to bash anyone, but a lot of the hospital systems, they want to kind of keep their patients within their system to the detriment of the patient, which again blows my mind. But they have a limited space, and they have so many machines. So let's say you have 30 people, and that's 12 weeks. They can't put in 31 persons, right? Because they only have 30 machines, or they have 2 people as personnel. So they're limited, but they're not going to refer outside because they're going to say, oh, we don't want you guys, we don't take anybody's patients. We don't take anyone, outside of their rehab. We're not here to steal patients or take you away from your hospital system or your doctor or anyone. That wouldn't be good business practice for us, first of all, and secondly, that's not our goal. Our goal is to help people. Our goal is to make people better. Just give us a call. We'll do a lot of the legwork for you.
Sylvia asked, what does 98% success mean? As in, what do you consider successful? So, as successful as, let's say, let's say you go into the care plan with us, and Dr. Shaw or I, you mentioned that you want to come off oxygen, you want to walk further, you want to get your life back, you want to go back, whatever the case may be, whatever your goals are, that's what we would consider successful. As long as the goals are realistic. Now, if you're asking that you want to run the Boston Marathon and you can barely walk a foot, then we're going to say that might not be realistic, of course. But if your goals are realistic, that's what we consider as successful. If your goals, and you want to walk further, you want to get an increase in your lung functions, you want to be able to walk longer, get stronger, be less stressed out, go through stress management, have a better diet plan, then we would establish that as your goal. And if we can get you up to that goal, that means you're successful. So from everybody, from what they first started to until they leave the program, if we get you close or exceeding those goals, that means that's 100. Like, let's say your goals and we achieved everything on your goals, that's 100% successful. We're at 98%, so most of the time, we're right hitting it, if not surpassing it. But then you have some people that don't take the program as seriously, and they do it only when they feel like they want to. And that's why the numbers aren't at 100%, because you still have those stragglers that don't put in as much effort as other people that actually want to get better. So that's what we mean by the success rate is based off of performance done at your home, and how well you're doing throughout, and what your prognosis is afterwards.
Yeah, you don't have to go anywhere. So no gas, buying gas or standing in line for gas. No wear and tear on your car. You're in control. You are at your house. doing it at the privacy of your home, very comfortable area where you're doing it. It's very nice. Now the other thing, besides the 98% success, we have over 98% compliance. So part of success is people staying in the program. The compliance in the whole country for outside of our program, the whole country is between 20 and 30%. We're over 98%. I mean, these are real facts. So you can imagine, like, part of compliance or part of success is compliance. Like, if you're not going to do something, obviously it's not going to be successful. But if over 98% of you are going to be doing it, then you're definitely going to be successful. So it works hand in hand. So again, the whole country, the compliance for pulmonary rehab is 20 to 30% at best. That means people maybe take 1 or 2 classes and then they can't make it. They can't drive there. They don't have someone to take them. You know, they're having exacerbations. They're having difficulties, getting out of the house. A lot of patients have difficulty making their bed. So, how do you expect somebody to go out, 3 times a week to try to exercise? It makes no sense. This program makes sense. Will Medicare pay for your rehab? Medicare does pay for our rehab, Carol. Do you take Medicare? Yes. Applying to Fredora.
Oh, that's Brianna.
Oh. That's Brianna.
How long is your program?
How long is our program? So typically our program is 12 weeks, typically. Now, I will say, if your goals have not been reached and you want to continue, we will continue the program beyond the 12 weeks. So this is a chronic disease. It's not like what we're doing is going to fix you and you'll never have to do anything after that. That's really not the case. It's a chronic disease. It's there for the rest of your life. So that the things that we're trying to teach you are to teach you things to modify your lifestyle. And at 12 weeks, it's not like, okay, it's not a Richard Simmons, like, okay, at 12 weeks we're done. It's you may need longer period of time, and we're able to do that. So some may need longer, some may need a little bit less, some may need just a 12 weeks. So I don't want to get hung up on the 12 weeks and boom, that's it. It's not like that.
Sorry.
Michelle says, I'm in the program with Millie. Is awesome. Thank you, Michelle. I want to talk further than I do. Walk further than I do. I cannot clean my house. I need a cleaning lady. I hate that. I wouldn't mind having a cleaning lady though.
But if you're, some people I like cleaning my house.
Yeah. No, I'm just joking. Look, the thing is, we're going to give you techniques on what to do when you're out and about, what to do when you're going up the stairs. So part of that is what to do when you're cleaning. Now, cleaning, the only caveat I would say is if there's a lot of dust, then you have to be careful. That can kind of make things worse. But outside of that, or sprays and things that you may be inhaling, outside of that, I would love for you to, if that's something that you want to do, clean your house. We would help you do that. I mean, and not clean your house, but I'm saying that give you techniques to as far as breathing, as far as bending over, as far as getting things from the ground. These are some of the techniques will help you learn. So.
Somebody tweeted, I gave you some questions. I did not see you answer any. I'm not sure who you are, but if you can do me a favor and follow us or join the COPD rehabilitation support group that we're in, so we can at least know who you are. But I just don't know which questions you asked, because I'm going through all the questions and relaying the questions with Dr. Shaw, but I'm not sure which question. Can you rewrite your question on there so I can see it? I'll give you about we don't have much time on here left for Dr. Shaw, but we have about 10 minutes left. If you can write down your question, we'll be happy to answer it. And where are we located?
Well, we're located in outside of Baltimore, but we are
A virtual program, so.
yeah, we're virtual, so we can be anywhere. We're in every state. That includes the West Coast, North, South, Texas. Saw a guy from Montana the other day, and someone from Florida, Hawaii, Alaska. We have some people in Puerto Rico. So we're everywhere.
Yeah, virtual means that we see you, you see us. It works like a two-way mirror where you can see us and you can hear us, and we can see you and we can hear you. Online pulmonary rehab, like some other ones out there, there's no peer review, so it's like a one-way mirror that time, where you can see the clinician, but you can't. But the clinician cannot see you, and plus it's pre-recorded. We don't do the pre-recorded. We do have a pre-recorded program like the Mind You Lungs, but this is a virtual program, so you stay home, do therapy in your own home, while we see you in your home through virtual, means through your camera on your tablet, computer, or smart device. North Myrtle Beach here. Yes, we go to Georgia. Anywhere there's a satellite in outer space, we can reach you. So there's no excuse. And guys, don't worry, we love you. But the thing is that there's a lot of people in here that looks like they actually need some help. So we would love to help you if you would help us help you. Sharon, we love you too.
So the question is, I'm on a breath machine to walk. I am on 5 liters, still can do much. I am on it 24/7. I wish you would come to Daytona.
We don't have to. We're already there.
So we're virtual. So you can see us in Daytona. You can see us anywhere along that coast or anywhere in Florida. Call us up. Let us really talk to you. Answer some of the questions that you have. We'll put you through the rehab, and we'll really help you. I think you seem like one of the people who could definitely help. How do you know if shortness of breath is lungs or heart issue or both? Mary, you're asking some very good questions. So sometimes you don't know if it's coming from the heart or the lungs. Typically, if you have COPD or a lung issue, it's going to be coming from your lungs, and if you have heart failure, it's going to be coming, or heart issues, it's going to be coming from your heart. Now, it's kind of a tough question to answer in like 2 minutes or 5 minutes. You're going to need PFTs, maybe X-rays or CAT scans, maybe an echo, maybe a stress test. So, there's many ways to kind of figure out if it's heart or lung. And you may know a lot of people where the lung doctor says it's the heart, and then the heart doctor says no, it's the lungs. So we're always in constant quandary with that. COPD, emphysema, and aspergillosis. So typically, if you're going to have all three, you're going to have problems. It's going to be lung related, just by those 3 diagnoses there.
Yeah. So the number is right here. It's 410-871-4601. You can also go to our website, which is www.homerehabnetwork.com, or you can just simply just look on some of the posts on there. They have that. If you guys can do us a favor, just because you might know somebody who has some breathing problems, I wouldn't mind participating. But if you can subscribe or follow us on YouTube, Twitter, TikTok, or even Instagram, any of those, we would be happy to keep this going. But the only way we can keep this going if all you great listeners right now are giving some really good questions. So if you can keep this up, we'd love to keep going on this and keep this.
That question.
What was that question there? Oh, the one on the top?
Yeah. I'm seeing a pulmonologist. She told me that she's considering a lung transplant for me, and I didn't know how to accept it, and I started crying, and she going to say to me, "What are you crying for? What is it? What it is? I feel like she was very disrespectful. So how do a person know if it's that bad fit transplant?" So I think what you're trying to say is, how do you know if you are a candidate for transplant? Um, what typically a regular pulmonologist would do is, they would refer you to a bigger center where they would kind of do a workup to see if you are a transplant candidate or not. That's based on certain parameters. If they feel like you are, then there is a whole host of, um, lab work and other testing and psychological testing and before they would even consider you as a candidate. So the other kind of good news is that, well, it is good news. The horror stories of transplant, as the time passes, they're selecting better patients to transplant. So the outcomes seem to be getting definitely better. So the other thing is, make sure you go to a place that is doing, or a doctor that is doing transplants, on a regular basis. It's not something obviously you want to just go to any place. You want to have a place where they have been doing it. They have a whole team that's going to be there afterwards. What is your opinion on valves? I think the valves can definitely help. Again, valves. Well, valves require pulmonary rehab, but the valves, especially in a place that's been doing them, again, experience is very helpful here. I can tell you our folks at Inova are excellent. They're doing great work. A little shout out to them. They're very good. But being the right patient, as far as selection, that's part of the outcomes. But valves in certain patients who really need them are actually very good, and they do definitely help. Everyone that gets valves should have pulmonary rehab, and we work with some of the providers that do the valves. So definitely, I would get evaluated for valves. I was only diagnosed by CT with pulmonary fibrosis. Doctor was wanting to get lung biopsy. Will that be helpful? I have no family or immune problems. Pulmonary fibrosis.
Just in case.
Oh, okay. All right. By the way, this is one of the valves here.
Bring on the camera. Yeah, right there.
So you see that? They're kind of really tiny valves. And they come in a couple of different sizes. Sometimes they have to adjust them depending on the size. Somebody asked a question about the pulmonary fibrosis. So pulmonary fibrosis, here it is. Doesn't know what I have like case of pulmonary hypertension and emphysema, no smoking. So pulmonary fibrosis is kind of like this. It's kind of like COPD. It's kind of like this nebulous term. Within pulmonary fibrosis, there's different types, and each type kind of has a different trajectory. Of them, IPF, or idiopathic pulmonary fibrosis, is something that typically doesn't have such a great prognosis. So most pulmonary fibrosis, we usually do not do a biopsy. We do biopsies when we're not sure what the cause is, and other blood work have kind of come back negative. That's one reason why we would want to do a biopsy. And then the question is, what kind of biopsy? Is it bronchoscopic, or is it what they call a surgical biopsy? Typically, in this case, it's usually a surgical biopsy. because you have pulmonary hypertension and emphysema, good idea to speak with your doctor. But ask the doctor what is the pattern of this fibrosis. Does it look like idiopathic pulmonary fibrosis, or does it look like chronic aspiration? Does it look like sarcoidosis? Does it look like there's many different kinds. So the CAT scan and the pattern on the CAT scan gives a clue of what it may be. Why do I have more dizziness and breathlessness with activity? Also, does Medicare only pay for rehab one time? The dizziness can be related to your oxygen level or carbon dioxide level, so have that checked. It can be related to your heart. It can be related to pulmonary hypertension, so make sure that there's an echo and they're looking at that. So those are things as far as dizziness. Maybe there's an inner ear problem. I'm not sure. There's many things that can cause dizziness. Now, as far as Medicare, Alex, can you answer that question?
Yes. Why do I have more dizziness than breathlessness with activity? Also, does Medicare pay for the rehab? So so first off with the dizziness, this is from M Price from YouTube. Thank you for joining in, by the way, and watching. But so dizziness is usually heart related or some pressure regulations. But basically, once you get into the rehab program with us, we'll look at and see everything. And give you a better answer than, because right now I'm not 100% sure everything you have, the problems that you have. But also with Medicare, only pay for one rehab. They pay for necessity. So if a doctor, let's say, puts you in pulmonary rehab before for, let's say, it's this COPD exacerbation that you had, and then you went through there, but then you have another complication with something else, maybe COVID. If it's a necessity, especially with the pandemic, they have given no limitations for pulmonary rehab. So I would say the best thing you could do is you can call your insurance company, but I would recommend, because we have billers in here that they just know the ins and outs with these things. And that's, I'm not a biller, so I don't 100% know everything with that. I just know pulmonary rehab. Anyways, I would suggest calling us, and then we'll just verify to see if Medicare will continue. But usually we haven't seen Medicare say no to us. So I would actually call us first, and we'll double check with your insurance company as soon as we know who you are and stuff, and as long as we get your permission, we'll call up the insurance company and just double check to see if you're still good before you even start the program. We want to make sure that you're not blindsided by anything. So before anybody starts, we want to make sure that everyone knows the program, but also knows any types of anything with their insurance, and we'll just let you know right then and there. After, of course, we talk to them, but usually there's no limitations right now. As long as the doctor referring says that you need pulmonary rehab, they usually will always let you in.
All right, just a couple more here.
Yeah, it's 1 o'clock.
Okay.
So these are only two more questions we have, and that's it, guys. I do apologize.
Oh, so the Facebook user here is asking. I try to do it. They make me go through a lot of tests for about 5 days. I did not pass. I tried for valves, did not pass it either. I only breathed 22%. Give us a call. We'll help you achieve your goals. So please give us a call. Can 1 moment of accidental exposure to yes, not COPD, but it can give you reactive airways or asthma. One exposure can do that, yes. What strengthens your lungs when you have had a lobe removed? Same thing that strengthens your lungs when you haven't had a lobe removed. So call us, please get involved in the pulmonary rehab program here. And that is what's going to strengthen your lungs, because we're going to give you techniques. We're going to show you how to do it, and we're going to do it step by step. And by the end of it, you're going to learn a lot, do a lot, feel better mentally and physically. So please give us a call. Our phone number again, 410-871-4601. Give us a call. Get involved. Get involved in your health. Get involved in your well-being. Don't wait for someone to do it for you.
Okay, guys. That's it. We'll see you back on Tuesday, unless you're getting the program. If you're in my program, I will see you on Monday. And if you're trying to get a program with me, just give them a call. Try to get you in. You know, even if you, you might have to fill out something if you're not registered in with the program itself, just to try it out. You guys do know you can do that. You can try out the program with me. My class starts at 10:30. I would suggest calling them first, and while you're waiting, you can at least start classes. But remember, classes, it's educational, but it's also exercise. So we actually exercise together. It's not just education. It's exercise that we mainly do. Guys, that's it. Thank you very much. My class, just show up with a paper and pen. I will go through everything that you'll need, which is not a lot. It's just I just got to make sure you have a pulse oximeter. I got to make sure you understand what days you're going to do therapy, all that stuff. So just on Monday, I'll see you on Monday. But just pen and paper. It's just going to be the beginning class. I just got to go over the do's and don'ts really quick and how to set up your room for therapy temporarily until you're better. Guys, that's it. Thank you very much.
Thank you, everyone.
Please follow us on Facebook, Twitter, and YouTube, and all those other